Hello, I'm Bob Falcone, CEO of the Columbus Medical Association, with our regular COVID-19 update. Today, I'm honored to have Dr. Mysheika Roberts, who's Health Commissioner for City of Columbus Public Health, and Dr. Miller Sullivan, who is the Medical Director for Franklin County Public Health, to help with our discussions. Let me start first with a brief summary of our hospital situation. As you probably know, we are part of a 36 county region with 41 hospitals. And our hospitals are averaging, as a total, over 1,100 COVID patients a day and greater than 95% capacity. Despite this, they're coping very well. They're making creative use of space, they're making creative use of their staffing, and they've implemented a number of outpatient protocols that are helping. They're also selectively pausing non-urgent admissions to make space for those that are critically ill and those who have COVID. One of the reasons the hospitals are doing well is that every morning we have a virtual meeting with 41 hospitals from 36 counties. We talk about census, staffing, bottlenecks, potential resource needs, and when needed, we share patients, especially in the rural counties, which do not have the capacity for patients that our Central Ohio hospitals have. So it would be wrong to say we're not stressed, but I think it's accurate to say we are coping. Dr. Roberts, Dr. Sullivan, how's the city and county doing with COVID?
Well, thanks for having me, Dr. Falcone. I appreciate being here and your viewing audience. The city is touching on almost 50,000 cases of COVID-19. It has been a very busy time for us, really over the last 3 to 4 weeks. The intensity has really picked up in terms of our volume of cases. We're averaging here in the city of Columbus, which also has jurisdiction over the city of Worthington, over 500 cases a day. And, just to make sure everyone understands what our job is we're tasked with interviewing each of those cases to understand where they are in the spectrum, how sick they are, who they could have exposed, to identify their contacts, as well as reach out to those close contacts. So it's been taxing on my team. In addition to doing the case investigation, we have also working with our adult hospital systems and providing COVID-19 testing at the fairgrounds. Through that process, we've tested over 18,000 individuals. And today is the last day, but we've also been offering the flu vaccine at the fairgrounds. And we are wrapping that operation up today at the fairgrounds. We'll continue to provide flu vaccines here at Columbus Public Health, but we are preparing our team to be able to start vaccinating individuals in Group 1A for the COVID-19 vaccine.
Great. Miller, how's the county doing?
Well, pretty much the same way. We continue to have a lot of cases. I think we're up to about 21,500 total now. In the past 10 days, we've averaged 350 to 450 cases per day. Obviously, some deaths also. We continue to track this. It's been very challenging with all of these cases to do contact tracing. They've made some changes in how they do that, but we continue to try to protect the public. We track where the hotbeds are. There's certain areas of the city or of the county that seem to have more cases. Hilliard, Grove City, Reynoldsburg, and we work very diligently to help those populations too.
Yeah, I don't think we've seen the peak of our Thanksgiving COVID numbers yet. The day before Thanksgiving, the state of Ohio had 10,000 COVID patients. Yesterday, it had almost 12,000, and I'm not sure where that's going. Do you have thoughts on that? Either of you have thoughts on that?
Well, obviously, I'm very concerned. The Thanksgiving holiday was just really the peak of the holiday season, well, the start of the holiday season, I should say. And we know in December, we've got multiple holiday celebrations coming up, and most people want to get together and celebrate this time of year. And I'm very concerned that people will not follow the guidance of public health. I appreciate what Governor DeWine put out yesterday and reminding people we just need 21 days. 21 days, if we can focus on this, we can try to drive these numbers down and be in a different position in January, a better position in January. But I, like you, Dr. Falcone, I'm not certain that we've seen the true impact of Thanksgiving yet. And yesterday we had 800 cases reported to us. That was a significant increase. So was that the Thanksgiving surge? It's hard to tell.
And I think the problem is this is going to continue through the entire month of December, as you indicated. There are several holidays coming up. And frankly, people are tired. They're tired of isolating. They're tired of being home. And I think as an individual, they feel, well, I'm just going to go visit somebody. And, that's great, but that's not good from a public health point of view. And that's why we continue to put out this message and try to encourage people to avoid those situations.
Yeah, and both the city and the county had issued a voluntary stay-at-home order, but emphasized that it was important. And the governor increased the curfew through the holidays. Is there anything else we should or could be doing?
Well, you're right. We did put the stay-at-home advisory in place, and we've got one more week of that. And unfortunately, I can't say that that's really made a significant impact. So I think we're looking, along with Franklin County Public Health and along with our political leaders here in Franklin County, of what more can we do to slow the spread of this virus in our community.
I think the problem is that many of the things we've instituted just haven't worked, and I think we continue to seek solutions. I'm just not sure there are any right now.
Yeah, I think the people watching understand that, but it's so important for each practitioner who has patients to emphasize this is real, this is important, and they need to mask, they need to wash their hands, they need to socially distance, and they need to avoid visiting outside their household or bringing people into their household.
It's incredible when people come in my office, because I also am in practice, and they just say, well, I don't think it's a big deal. But you look at the almost 300,000 people, that have died in the United States, that's real. And I just don't see how people don't buy into that.
Yeah. Well, one of the respites we're seeing is recent guidance from the Ohio Department of Health and from both of your health departments about quarantining employees after a COVID exposure. Mysheika, you want to talk a little bit about that and how that looks?
Sure. So CDC came out with recommendations that Ohio Department of Health acknowledged and adopted to reduce the quarantine period. I think everyone knows that since the beginning of this pandemic, we've been saying if you've been exposed to a close contact, you've been exposed to a case, again, meaning you were within 6 feet for 15 minutes or more within a 24-hour period, you needed to quarantine for 14 days, monitor yourself for symptoms. Now, we've got new guidance that says that 14 days can be reduced to 10 days for the general public. So that's great. We hope we get better compliance and more compliance with the general public by reducing that quarantine from 14 to 10 days. But the other good news that came out of this is there's an option to do a 7-day quarantine that we think will be great for our healthcare workers. So we are acknowledging that and supporting that healthcare workers can be quarantined for 7 days, assuming they have a negative test within 48 hours of that 7th day or within 5 days of that exposure. We're only doing this for healthcare workers because we feel like the healthcare system has the ability to test their individuals as well as monitor the situation. As you know, testing is still somewhat of limited supply here in our area. So we want to preserve the testing for those who really need it. And we know our healthcare workers are in demand right now. So we are making that available for them.
So Dr. Roberts, really other people from industry who might have retail business and so forth should count on 10 days.
That is correct.
From a non-public health perspective, since I am in practice, obviously we see this at the hospitals where the ICU people, the people working in the hospital are being short-staffed because of illness. But in the offices of primary care and specialists, I mean, we had 3 people out of 15 out last week with either COVID or exposure. So this 7-day thing will really make a big deal for us. And I think we are able to handle it and follow the rules appropriately. So I think it would be very helpful keeping our workers on the line where they need to be.
Yeah, of course. And as I understand it, most of these exposures are not happening on the job. They're
Yeah.
happening afterwards. People who are going to other people's houses, going to parties and so forth. So even our healthcare workers are not immune to doing the wrong things, which is
It's
unfortunate.
it's amazing. Many of the people who come in, they say, I just have a mild cold, a little sniffle, and then they test positive. So I think the symptoms don't even let them lead them to think that they have COVID. And then so they don't isolate themselves with those symptoms. And it's important to do that.
Yeah. What an incredibly insidious and unpredictable disease COVID-19 has turned out to be. 10 years from now, we'll probably know all about it in retrospect, but that's not going to help us today. As you both know, the FDA advisory panel yesterday approved the Pfizer vaccine. That's the one that has to be stored at 20 degrees below freezing. And the FDA is expected to approve that and provide us some guidance on emergency use, hopefully in the next couple of days. And then it will be shipped. In Ohio, it's going to 10 healthcare organizations who are strategically located, who will um, provide that vaccine in some prioritized fashion uh, to their frontline employees. Mysheika, do you have any more detail on that? Dr. Roberts, do you have any more detail on that?
Sure. So yeah, we're fortunate. We have two hospital systems here that will be receiving it. That's Ohio State Wexner Medical Center, as well as Riverside Hospital, Ohio Health's Riverside Hospital. So when they receive those vaccines, they will be one, keeping some for their staff, but then pushing it out to some of the other hospital systems in our region to make sure that everyone gets this vaccine that are frontline workers. The first group, which is 1A, is targeted towards healthcare workers that are likely to be exposed to COVID or taking care of COVID positive patients. Included in that is also people who work in long-term care facilities, as well as the patients of long-term care facilities or senior living facilities. So, and EMS. So that's kind of the first group that we're going to be targeting here in Ohio and trying to get as many of those individuals vaccinated as soon as this vaccine comes about. And, you know, we've been talking to the hospital systems at Columbus Public Health, working with our state health department for several weeks, planning and preparing of what will this look like, who's the priority, and helping the state really determine what those priority groups should be. So I'm excited. I'm looking forward to the announcement that hopefully will come out today. And hopefully we can start vaccinating residents here in Franklin County who are on the front lines next week.
And just to make it clear, these vaccines going to these 10 institutions are meant for those institutions. They're not meant to be shared. There will be a second and third and probably fourth and fifth tranche of vaccine going out to other institutions who have signed up to be sites. Public health is one of those, isn't it?
Yeah, so Columbus Public Health did sign up to receive the vaccine. We want to, one, vaccinate our staff who are on the front lines and will need to be involved with vaccinating our EMS. And so we are expecting a dose or a shipment at some point before the end of 2020 so that we can get some of our staff vaccinated, our nursing staff who will be providing the vaccine, and then get our EMS vaccinated, who are obviously on the front lines every day encountering patients that they don't know whether they have COVID-19 or not.
We're doing the same thing. And our efforts at the moment are being to set up pods, so to speak, and how we're going to immunize our first responders, because that's really going to be our priority when we get some vaccine.
Yeah, Dr. Sullivan, while you're speaking, can you talk a little bit about how this is going to affect private offices, for example, your office?
Well, that's a great question, because I get that question every day, many times a day. When can I get the vaccine? And the answer is we don't know yet. Basically, it's down the line after the priorities have been determined, and we haven't even seen that I know of, further priority. I mean, they're talking about the first people, but you can speculate, physicians' offices, the elderly, people with chronic conditions, but the exact protocol hasn't been released yet. To make things more complicated for me, I'm a pediatrician, and they haven't even studied this in kids yet. So I'm telling my parents, maybe next summer, maybe, who knows? To be determined is what I would say.
Yeah, and fortunately, as we all know, the kids are just often not affected like the adults are. In fact, our Columbus Children's Hospital has almost no COVID patients, and none of them are in the ICU or on ventilators. So that's good news for the kids. When we finally get the vaccine for our patients, which is probably going to be maybe late spring, perhaps summer, do we have intact protocols to determine who gets it first and how it's distributed? Do either of you have information on that?
Well, I know a lot of private offices or corporations have signed up to be providers, but we really haven't gotten guidance from ODH yet as to how that's going to work. I don't know, Mysheika, if you know more about that.
Yeah, so we are going to wait to see what CDC and ODH says, but we're also going to start talking collectively here in Franklin County. So there's consistency between the hospitals as well as public health, that we put the right groups in priority rankings and start distributing it that way. So, you know, we've got a little bit of time, since we've got a few months before the vaccine will be readily available to the general public. But we do think it's important that all of our hospital systems, as well as our 2 public health departments, are providing the vaccine to the same groups at the same time, and that no one's getting ahead, and that our residents don't start shopping around to say, well, if I go here, I can get the vaccine, but I'm not called up yet if I go over to this system over here. So.
And I think, although there's been a lot of disinformation, in general, I think the vast majority of us feel that the vaccine is safe and effective, even though it's gone through the process very quickly. It will be a game changer. This whole idea of herd immunity, I think, confuses most people. We eliminated polio because we no longer gave polio a source to spread. Now, we've done pretty much the same with measles and chickenpox, and I think we can do it with COVID, but it's going to involve a whole lot of people being vaccinated, isn't it?
Yeah, we're going to need, I think, at minimum, 70% of our population to get vaccinated. And, you know, from what we know, this is going to be an annual vaccine. At least that's what we understand at this point in time. So not only are we going to need people to get it this first round, but we're going to need people to get it, you know, the next year and the next year. So a lot of work to do, a lot of heavy lifting for public health as well as the healthcare system over the next probably 6 to 7 months. And I know we're all already tired because we've been battling this for over 10 months already.
Yeah, it's been an amazing 2020, and it's not over yet. So I would like to thank Dr. Mysheika Roberts and Dr. Sullivan for their time on behalf of the CMA. This is Bob Falcone.